Cindy was a very memorable patient. She came to see me when she was 56 years old, and she initially saw my partner in joint replacement because many times patients of that age often see the joint replacement team first. And one of the things that our joint replacement team quickly noticed was that here was a 56-year-old woman who was very active, does a lot of marathons, and also she has essentially no arthritis, very, very good joint space on her x-rays. So I saw her in the office sometime in April of 2023. And at that stage, we noted that she had a condition called femoroacetabular impingement syndrome, along with a labral tear, which is a very common injury in active young adults and runners and so forth. The hallmark finding of this condition is when patients have pain in the front part of their hip, especially with flexion and rotational activities. Additionally, on her advanced imaging, on her MRI, we saw that she had a detached labral tear, which certainly can be a big source of pain, especially in very athletic adults. So that's how we got connected. From a treatment perspective, Cindy was very similar to a lot of my patients who have FAI syndrome as well as labral tears. The first treatment that all my patients start with whenever they have this condition is a conservative approach. So we started with a very specific course of targeted physical therapy focusing on core strengthening as well as gluteal muscle strengthening. And the purpose of this initial conservative regimen is to try to optimize the pelvic tilt and the pelvic balance such that patients don't feel the symptoms from the impingement and the labral tear as much. When that didn't do the effect that we wanted it to give her, that's when we pursued an ultrasound-guided steroid injection into her hip. And the steroid injection was pretty effective. It gave her temporary improvement, but unfortunately pain returned shortly thereafter. And then at that stage, that's when we decided to pursue a hip arthroscopy. Essentially what it involves is first we put a little air and water into the joint to gently distract the joint, allowing us to put our scope into the hip socket, evaluate to make sure there's no other problems going on like loose bodies. But then very simply in the operation, what we do while looking at this area with the scope, arthroscopically, we first smooth down some very subtle bone spurring on the rim of the hip socket with an arthroscopic burr. Next, we sewed the labrum back to the rim of the hip socket with several small little suture anchors. And in her case, she did have a very detached labral tear. So, it certainly explained why she was having some significant symptoms. Lastly, in Cindy's case, we also smoothed some subtle bone spurring off of the femoral neck, making it much easier for her to have a smooth flexion and rotational motion without any pinching. One of the things that we noted very, right away when we saw Cindy was that, she has very, very good cartilage throughout her hip, despite her being in her 50s. So there essentially was zero arthritis. The other thing was that she did have a detached labral tear in the hip socket. What can happen over time as patients age is they can develop some very subtle asymmetries around their hip. So specifically, the ball and socket joint can develop some very subtle asymmetries on the femoral neck or on the rim of the hip socket or in both positions. And what happens is as these asymmetries develop, as patients lead an active lifestyle which includes flexing and twisting of their hip several hundred times a day, sometimes these asymmetries can actually pinch the labrum, causing it to detach at certain spots, specifically this anterior superior area of the acetabular rim. And the labrum is a very interesting structure. It's a joint preserving structure that actually provides a suction seal effect in the hip joint. It also promotes hip stability and cartilage nutrition. But when it's when a significant labral tear presents and the tissue is detached, you actually can get a movement of the labrum, which causes a lot of irritation. And that's why a lot of active people and athletic people often will have pain from labral tears. In Cindy's case, she was very special because she had a very strong goal to run in the Tokyo 2024 marathon, which was 6 months after her hip arthroscopy. And with our great rehab team, who are phenomenal partners, they were able to get her up and running pretty quickly. I'm incredibly grateful to anyone who sees patients with hip pain in their practice here at Northwestern, in part because I know how challenging it can be to diagnose and treat various hip problems. The main advice, if I could provide any, would be to, if a patient is complaining of pain around the hip, especially in the front of the hip, radiating to the groin, or even on the side of the hip, the lateral side of the hip, and if it doesn't get better in a few weeks, it may be a good idea to see a specialist in our orthopedic department, because many times there's a lot of simple things that we can do both on the non-surgical as well as the surgical side that often considerably improve their quality of life. I'm Dr. Sanjeev Bhatia, an orthopedic surgeon at Northwestern Medicine, and thank you for joining me on today's case review.